Dear students, welcome back. Now we will see the shape of the thorax. Here the thorax resembles a truncated cone. Here you can see the truncated cone. Yes, it is a truncated cone shape which is narrow above, and broad below, which is narrow above and broad below. Okay, the narrower upper end is continuous with the root of neck. So this narrower end is continuous with the root of neck. Okay, from which it is partly separated by, here you can see the suprapleural membrane. So, and this one is partly separated by suprapleural membrane, that is called Simpson's fascia. What do you call? This is also called as Simpson's fascia. Okay, the broad lower end is almost completely separated from the abdomen by a diaphragm. So this is the green portion is called the diaphragm. Okay, which is deeply concave downwards. This one is the concave, deeply concave downwards. Okay, again we'll see the thorax resembles a truncated cone. It resembles a truncated cone, narrow at the upper border, upper end, and broader below. Okay, the narrow upper end is continuous with the root of the neck, and it is separated by a fascia called Simpson's fascia, or also called as suprapleural membrane. The broad lower end is almost completely separated from the abdomen by the diaphragm, which is deeply concave downwards. Okay, the thoracic cavity is actually much smaller than what it appears to be. So మనకు కనిపించేదానికంటే కూడా the thorax is actually smaller, because due to the shoulders and the lower part is greatly occupied by the abdominal cavity due to the upward convexity of the diaphragm. So ఈ షోల్డర్స్ ఉండడం వల్ల so it occupies this space also అని అనిపిస్తుంది మనకి thorax. So this space is not formed by the thorax. So, and also this diaphragm, so it pushing this thorax upward and appears as large what actually it is having. Okay, this is about the shape of the thorax. If you cut transverse section of the thorax, it is in the form of bean shape. So you can see here we'll having the thoracic vertebrae, so through which this ribs are coming. So in the transverse section of the thorax, here you'll have the sternum. It appears in the kidney shape. So it is having two diameters. So this diameter is called as transverse diameter, and so from side to side is called as transverse diameter. From anterior to posterior is called as antero-posterior diameter. Okay, in this transverse section of thorax, the transverse diameter is greater than the antero-posterior diameter. However, in infants below the age of 2 years, so this thoracic cage is in the form of circular in shape. So it is almost all circular in shape. Only slight depression we can see, and the remaining thing is circular in shape. Whereas in the quadrupeds, that means four-legged animals, so the AP diameter is more than the transverse diameter. That means AP diameter, that means antero-posterior diameter is greater than the transverse diameter. So such kind of shape of the thoracic cage we can see in different types of individuals. Okay. In infants, normally I have already told that in infants, so it is almost circular in shape. This is the infant type of thoracic cage. So almost the ribs are horizontal. In infants, ribs are horizontal. Normally the ribs, here we are having this sternum, isn't it? So the ribs are arranged like this. It is having some angulation like this, isn't it? So such type of arrangement are not seen in the infant. So almost the ribs are arranged in horizontal. The ribs are arranged in horizontal in infants. So as a result, the respiration is purely abdominal. The respiration is purely abdominal. So that means there is no increase in size during inspiration and expiration. Only the abdominal pressure helps in, the abdominal helps in respiration. Okay. So we are going to see the action of diaphragm in detail in the respiratory movements. Then you can understand why it is called abdominal breathing and why it is called as thoracic type of breathing. Okay, so in infants, just remember that it is purely abdominal. Okay, in adults, the thorax is oval in shape. In adults, the thorax is oval in shape. That means what? So the transverse diameter is like this. The transverse diameter is greater than antero-posterior diameter. Here in this, in adults, the ribs are obliquely placed. The ribs are obliquely placed. Okay. And their movements of the ribs alternately increase and decrease the diameters of the thorax. So it will alternately increase and decrease the diameters of the thorax. So when the ribs are oblique, the diameters are going to reduce. That means the transverse diameter is reduced. Whereas if the ribs are elevated, then the transverse diameter is more. So such kind of elevation of ribs is seen during inspiration. So they explained as there is an increase and decrease in the diameters of the thorax. So this results in drawing of air into the thorax, that is called as inspiration, and its expulsion called as expiration. Okay. In the adult, we are having two types of breathing, that is abdominal as well as thoracic type of breathing are present in adults. So this abdominal is we can see in forced respiration. These abdominals will work actively. Okay, so these types of respiratory movements we will see in movements, how movements are taking place in the rib cage during respiration. It is an separate topic. We will see in that in detail. Okay, now coming to the applied anatomy. So coming to the applied anatomy, here the chest wall of the child is highly elastic. So, and the fractures of the ribs are very rare. And the fractures of the ribs are very rare in the infants because the chest wall is highly elastic. Okay. In adults, the ribs may be fractured by direct or indirect violence. So, ribs మీద గట్టిగా కొట్టడం కానీ ఏమైనా తగిలడం కానీ ఆర్ ఎనీ అదర్ ఇండైరెక్ట్ వైలెన్స్. సో ఎక్కడో దెబ్బ తగిలి రిబ్స్కి దెబ్బ తగలడం అనమాట ఇండైరెక్ట్. సో ఇండైరెక్ట్ వైలెన్స్ మీన్స్ క్రషింగ్ ఇంజరీ. So crushing injury. So the rib fractures in the crushing injury is commonly takes place at its weakest point of the ribs. So it is taking place at the weakest point of the ribs. So in the ribs, the weakest point of the rib is angle of rib. So actually the ribs are like this. Okay. So at the vertebra connection, it is having some connection. After that, the rib is having some curvature. Here it is having angle. So that one we will see in the osteology of ribs. Okay, the rib fractures at the weakest point located at the angle. The upper two ribs, so that is the first rib and the second ribs, are protected by the clavicle. And the lower ribs are least commonly injured. The lower ribs are called as 12th and 11th. 11th and 12th are least commonly injured. So, because of highly elastic nature of the chest wall in child, the fractures of ribs are very rare. In adults, the ribs may be fractured by direct or indirect violence. Okay. So, and the upper two ribs are protected by the clavicle and the lower two ribs are rarely injured. And so, in the case of thorax, I have told that there are 12 pairs of ribs and 12 thoracic vertebrae are articulating with the ribs. Sometimes what happens, so a rib is attached to the C7 vertebrae. So, C7 vertebrae, the rib is attached to the C7 vertebrae, then such kind of rib is called as cervical rib. What you call cervical rib? It is seen in 0.5% of people. Okay, so we know that C7 and normally in the spinal cord we are having C8 ligament, C8 spinal segments from where the spinal nerves are coming out and forming in the brachial plexus, isn't it? So because of this cervical rib, it exerts a pressure on the lower trunk of the brachial plexus, producing paresthesia. That means we can see the lower trunk injury of the brachial plexus because of the presence of cervical rib. Not attaching with the T1, it is going to attach with the C7 vertebrae. So it is called as cervical rib. So this is about applied anatomy of the thorax. Okay, in the next session we will see the superior aperture or inlet of thorax. Inlet means this one. So this is the inlet of thorax and the lower border is called the outlet. So inlet, through this inlet what are the structures are passing through this inlet, and outlet, what are the structures which are coming out through this outlet. So that thing we are going to see in the next video. Okay, thank you.